GP practices were not informed all at once about their list of affected patients. I just want to outline the timeline as it unfolded last week from my own practice's point of view. So on Monday the 5th of January, ManageMyHealth at very close to 5 o'clock provided our practice with a list of affected patients. And ManageMyHealth at that point advised us to let them know if there were any vulnerable patients on that list. I'm not actually sure what they meant by vulnerable patients. I presume what they meant was patients with particularly sensitive information, or patients that would be particularly affected by the data breach. However, it wasn't clear what ManageMyHealth were going to do once we had told them certain patients were more vulnerable than others. And because it was very, very close to 5 o'clock, and the understanding at that point was that ManageMyHealth had responsibility to inform patients, we decided to take no immediate action at that point. Tuesday, we sought clarification from our general practice organisations and advisors, and it was clarified that yes, ManageMyHealth are responsible for informing the patients if they're affected, and therefore we, at that point, because we wanted to let it be clear communication coming from one source, we thought it best not to get involved and to let ManageMyHealth inform patients. So then Wednesday, we received more names onto our list. So basically what happened was the National Enrolment Service was involved with refining the list of patients, because we were on our original list from Monday, we had patients who were no longer enrolled with our practice appearing on our list, and then basically by Wednesday there was a refinement to the list, so we got an updated list on Wednesday. And of course at this point we're thinking, well, is this actually a finalised list or not? So again, lack of confidence about whether that's a full list of patients. And again on Wednesday the instructions are wait for ManageMyHealth to tell patients. But of course we had no idea basically at the beginning of the week that it wouldn't be until Thursday that ManageMyHealth would start informing people. So yeah, by Thursday media reporting came out that by 5 p.m. on that Thursday, so last Thursday, ManageMyHealth would have started contacting the first 50% of affected patients. At that point we thought, enough's enough, it's too slow, we wanted to do our patients, give our patients a good service, so we decided to inform our own patients on Thursday. But that is why it's been a very disjointed rollout of what practices are informing patients, what practices are not informing patients. Hopefully you can see from a general practice perspective that it's been a confusing time, and of course that has led to confusion from a patient point of view as well.